So when using the JADA system, typically we'll set ourselves a timer, just at least to keep the team situationally aware of when we've hit that 1 hour mark. During this time, the patient is being followed really closely clinically in terms of fundal checks, in terms of any quantitative blood loss that's ongoing during device treatment. So we're really watching quite closely during this entire time. I think ideally we would sort of come together in a multidisciplinary way at the 1 hour mark and sort of decide, does it make sense to proceed with evaluating for device removal, at which point we would do our 30 minutes of observation with the vacuum off and the cervical seal down to really assess whether any bleeding resumes. I think practically speaking, as we all know on labor and delivery, things happen and there are multiple moving parts, so it's not always exactly at the 60-minute mark. But I think that ideally we would come together at that point to have a discussion. I think there are some unique situations where we may not be as anxious to stop treatment at the 1 hour mark, and those would be unique circumstances where perhaps the patient has had a very significant postpartum hemorrhage prior to initiating treatment. Certainly if the patient has any abnormalities in coagulation where we need to replace factors or transfuse the patient to a safe level, or if the patient's on medications that may relax the uterus or has an infection that may make the patient prone to bleeding. I think in those unique circumstances, we have the benefit of being able to continue treatment with the JADA system until we're sure that the patient is safe.
I think it's a mixture of things about when I decide to remove it. Of course, I want to make sure that the patient is stable and that it's working and it's done its job. But it's a mixture based on their risk factors. So if they've had a history of postpartum hemorrhage, they've had a large hemorrhage that had a transfusion, or I'm concerned about a reoccurrence of hemorrhage, then I leave it in longer. And I don't know that that's anything other than anecdotal experience that I choose to leave it in longer. If the patient is wanting to get out of the room and go see her baby in the NICU, then I tend to be a little bit more vigorous about using that minimum time for the hour and a half with that observation time. So I would say that it really just depends on the patient, but I also think that over time, now that I've used it for such a long time, I'm really comfortable with using it for the hour and then watching for 30 minutes.